Understanding your ovulation should not be as complicated as it is today. A lot of women in their childbearing age don't understand their ovulation, and this has led to a lot of delays in getting pregnant. Okay, now today in this video, I am going to simplify as much as possible how to understand your ovulation and the best way to increase your chances of getting pregnant. So if you have been tracking, you have been guessing, and you've not seen any positive result, don't worry. By the end of this video, you will learn when to ovulate, the best time to track your ovulation, and also how to increase your chances of getting pregnant in the cycle. All right, let's get into the video. Ovulation occurs when one of the ovaries releases a mature egg. This usually happens once in a month, but sometimes the two ovaries can release an egg depending on your reaction or your status at that particular month. Now, for you to understand your ovulation, you need to know your menstrual cycle. This is where it gets very tricky. A lot of women don't understand their menstrual cycle, and it will be very difficult for you to know your ovulation cycle if you don't know your menstrual cycle. Now, the average menstrual cycle is usually 28 days. Therefore, ovulation is on the 14th day. When growing up, we all learned that our ovulation usually on the 14th day because that is the average. But menstrual cycle from 21 to 35 days is usually considered normal. Some people have short length while others have longer length. Now, it all depends on the one you have, but understanding the one you have will really help you to understand your ovulation. So if your menstrual cycle is 28 days, definitely your ovulation is going to be on the 14th day. If your menstrual cycle is 30 days, definitely it's going to be on the 16th day when you add 2 days to the 14th. Now, the best way to understand the day you ovulate is when you minus 14 from your cycle length. For example, if my menstrual cycle is 28 days, once I minus 14 from 28, I'm going to get 14. So that is my ovulation. If your menstrual cycle is 30 days, when you minus 14 from 30, you're going to get 16, and that is your ovulation. All right, this is how to understand it. Now, the best way to track your menstrual cycle is to count from the day your period starts in this cycle till the day before it will start in the next cycle. For example, if your period starts on the 10th of May and starts again on the 3rd of June, you're going to count from the 10th of May till the 2nd of June. That is your menstrual cycle. So, and you're going to count it too. You're going to count it one, starting from the 10th. 10th is the first day. So you count from 10th to 2nd of June. It's usually a day before the next period. So if your next period started on the 3rd of June, you're going to stop counting on the 2nd of June. If you calculate it, that is your menstrual cycle. Now, if you track it for like 2 to 3 months, you will know your menstrual cycle. Although some people have varying cycle. Some people will have 30 days this month. Next month, they will have 35 days. Now, something is wrong somewhere. It's either you're having hormonal imbalance, or you stressed yourself, or you didn't eat properly, or something else is happening that is making your ovulation or your cycle to be irregular. Okay, now this is the easiest way for you to understand. If you can understand this and track your ovulation, I believe it will be easy for you to know the next step. What are the signs that you are ovulating? Before you track your ovulation, you need to understand something, all right? There's something called fertile window. This is a period where your body is most fertile, and there's possibility that you will get pregnant once the egg releases at this period. Usually, sperm lasts in the body between 3 to 7 days, depending on your body system. Now, your fertile windows is usually 5 days to your ovulation and 2 days after. If your ovulation is on the 16th, like we calculated on the 16th day, probably in the calendar is 16th of May, that is your ovulation day, your fertile window will start on the 12th. Start on the 12th of May until the 18th of May. So it's going to be 5 days before and 2 days after. So within that period, if you meet with your partner, the possibility of the sperm staying until the peak day of your ovulation will be very, very high. So this increases your chances of getting pregnant. Now, once you start ovulating, these are the signs you will see. You see cervical mucus. It will be slippery, transparent, and slippery. All right. Your basal body temperature will increase. Your temperature will increase a little bit than usual. You start having high libido. Most women have food aversion. Others will eat so much. Some people have this high libido is usually general. You have a lot of vaginal secretions at this period. Your body will be soft and tender. This is a sign that it is inviting. Now, at this time, once you meet with your partner, your chances of getting pregnant is high. But please note that for a woman in her childbearing age that has no issue, we have 25% chances of getting pregnant at each cycle. Having the basic knowledge of your ovulation cycle and your menstrual cycle will help and increase your chances of getting pregnant. Now, many people have done all this and still they have not really gotten the result they want. That is to show that there's an underlying cause that needs to be addressed. It could be hormonal imbalance, it could be stress, it could be an underlying disease that needs to be treated, like infections and all these other diseases that needs to be addressed. So if you have tried all this natural method, all these ways of getting pregnant and it's still to no avail, please, the best thing to do is to see a gynecologist and talk it over. Some people need to boost their ovulation. You understand? Some people need to treat. Some people need to lose weight. Some people need to balance their hormones. Some people need to reduce stress. Little things hinder the balance of our hormones. So you need to know exactly where the problem is coming from. Okay. Now, to increase your best chances of getting pregnant, you have to eat healthy. You have to maintain a normal weight. You have to rest. You have to sleep. You have to take folic acid. Very important. Folic acid, coenzyme Q10, vitamin E, vitamin C. All these vitamins will really help you to boost your ovulation and also help in balancing your hormones. If you can carefully apply all the tips mentioned in this video, it will increase your chances of getting pregnant. All right. The secret is knowing your ovulation day and knowing your menstrual cycle. All right. Reducing stress and treating any underlying cause that will prevent you from getting pregnant. Remember to include your partner in everything you're doing concerning your fertility. It don't have to be you alone, the woman. Make sure that your partner is fully involved. Okay? My name is Nurse Nelo. I'm a nurse midwife and I share pregnancy and fertility tips every day in this channel. Don't forget to subscribe, ask questions in the comment section. Anything at all that is confusing about this topic, ask in the comment section and I'll be here to reply you upfront. Don't forget to subscribe to my YouTube channel, turn the notification bell so that when I post videos like this, you'll be the first to see it. All right. Don't forget to share to other mothers so that they can also learn. Okay. See you in my next video and bye for now.